The criticism of not enough research, hey? This quest for the understanding through research regarding parental alienations continues unabated. This is certainly evidenced by today's theme, research regarding parental alienation, and the distinguished group of scholars here today to present their latest research. Today's presentations are organized into three broad groupings: conceptualization, interventions, and tools to help in diagnosis. Dr. Stephen Miller, Dr. Eric Green, and Stan Corsi will expand our conceptualization of parental alienation. Dr. Miller will provide an overview of key scientific and clinical issues. He proposes an evidence-based approach informed by current clinical science in understanding the concept of parental alienation. Dr. Green, in the goal of increasing awareness and acceptance of parental alienation, will talk of research focusing on the negative effects of conflict on children. PhD candidate Stan Corsi will expand our conceptualization of parental alienation from a social phenomenological perspective. New forms of intervention programs will be presented in a panel discussion by Linda Gottlieb, Dr. Deidre Rand, Shirley Wanlin, and Karen Woodall. Louis Pilla will be our moderator. With the aid of these distinguished panelists, we will hear about three programs effective in restoring the critical parent-child relationship that has been compromised by parental alienation. We will learn about turning points for families, family bridges, and the Family Separation Clinic in London. Wanlin's recovery consultants assist targeted parents in finding appropriate therapeutic options. The moderator, Louis Pilla, will further introduce the panelists this afternoon. The final group of presenters will share with us newly developed instruments to aid in the diagnosis of parental alienation. Dr. A. Warren Klein will explain the use of a parenting report card in evaluating parental behaviors. Dr. William Burnett will further discuss various instruments that can be used in testing for parental alienation, along with the recently developed Parental Acceptance Rejection Questionnaire. As the last thing we will do as a group, both presenters and you, the participants, we will develop, in 15 minutes or less, a PASG to-do list based on the material presented today. I would like to conclude as a deliverable with 3 or 4 specific tasks that we should accomplish in the next year or so. I am privileged to be among you and welcome you and our distinguished presenters here today. So let us begin. Stephen G. Miller, Dr. Stephen G. Miller begins today's session with an overview of the science of parental alienation. Dr. Miller holds degrees in psychology and medicine. He presently specializes in behavioral and forensic medicine in Cambridge, Massachusetts. For 30 years, he was a clinical instructor in medicine at Harvard Medical School and presently does consulting work through the Massachusetts Medical Education Group. His medical interests include clinical reasoning and medical decision-making, and his professional focus includes parental alienation and other types of pathological alignment. In 2014, he and Linda Gottlieb testified in front of a child custody task force in Connecticut, urging for the need of subspecialty training in parental alienation. There have been many misunderstandings and controversies regarding parental alienation and related concepts. Some of the misunderstandings and controversies reflect a lack of knowledge or expertise on the part of critics. Others reflect legitimate differences of opinion on perspective among bona fide specialists. This presentation will attempt to provide a balanced perspective with respect to key scientific and clinical issues, distinguish between what is evidence-based and what is not, distinguish between genuine controversies and those that reflect scientific, clinical, or other misunderstandings, and propose an evidence-based approach that reflects current clinical science. Please welcome Dr. Stephen G. Miller.